Good day. My name is Ariane Laplante Lévesque. I lead the program on ear and hearing care, as well as eye and vision care at the World Health Organization Regional Office for Europe. It's with great pleasure that I accepted the invitation to participate in this important virtual lunch debate today. I know that the organizations that I've presented today so far, they have converging visions for the future of ear and hearing care in Europe. And I'm also aware of the danger of presenting last in such events because there might be some repetition that might be occurring. I hope you'll bear with me. I also come from a family of teachers, and we used to like to say in our family, as the saying goes, that repetition is the mother of learning, the father of action, and the architect of accomplishment. So maybe some repetition is okay after all. And most importantly, I hope that you'll agree with me that in that repetition also comes an idea of alignment. And so I hope that today leaves you with the clear message that multi-sectoral stakeholders within ear and hearing care, whether that be representatives of users, professionals, the industry, or intergovernmental agencies, they have a lot in common, and they're very good at working together to support the strengthening of ear and hearing services in Europe. Today, I'll present the perspectives of the World Health Organization's Regional Office for Europe, and the perspectives more specifically on quality hearing care and rehabilitation. You've already heard from my colleague Shelly Chadha from the WHO headquarters in Geneva. You probably know that WHO divides the world into 6 regions, as you can see on the screen. The WHO European region is made up of 53 countries, and that includes all the 27 countries of the European Union. The office for the WHO European region is in Copenhagen, Denmark, and this is where I'm joining from today. I will set the scene by describing briefly the current state and challenges that I see as being faced by hearing and hearing care. I'll summarize the main messages of the WHO World Report on Hearing in terms of how to achieve quality hearing care and rehabilitation for all in Europe. The content of my presentation includes work from a whole group of people, including from WHO, led by Shelly Chadha, as well as other organizations, and many of those are represented here today. So thank you to all of you. Ear and hearing care, they're amongst one of the most common health problems that are encountered in populations, and they're on the rise. Here are some figures from the WHO European region. It's estimated that about 20% of the population live with some degree of hearing loss, and it's expected that unless action is taken, this will rise to 25% by 2050. We say that in children, over half, nearly 60% of hearing loss is due to avoidable causes that could be prevented should we have public health measures implemented. And some of those public health measures could be, for example, immunization in girls and women and good neonatal care. Likewise, in adults, most common causes of hearing loss, such as exposure to loud noises or to chemicals that could damage the hearing system, which we call ototoxic, they're preventable. Now, I've just told you that ear and hearing problems are amongst some of the most common health problems encountered in the community, but that doesn't mean that they're benign or that they're harmless, actually far from it. And investing in ear and hearing care, it's important for 2 reasons. Firstly, it's essential for good functioning for those living with ear and hearing problems, and also for those that are at risk of developing those problems. So thinking either of prevention and addressing the problems. So, and investing in ear and hearing care is also important for a second reason. That's because it is cost effective at a societal level. At a societal level, lack of ear and hearing care services, it comes at a very high cost due to the reduced educational and work opportunities that unfortunately often come with untreated hearing loss and the resulting social isolation that we see too often. In the WHO European region, we estimate that hearing loss costs about 210 billion euros annually. That's the cost of not addressing hearing loss. When we address hearing loss, we make one step towards making sure that all people realize their full potential, that all people contribute to the best that they can to society. And also addressing hearing loss doesn't have to be expensive. In the WHO European region, it would cost less than €15 annually per capita to provide ear and hearing care services. Based on economical analyses, we think that every euro invested would result in a return on investment of over 30 euros over a 10-year period. I'm just going to repeat that. Every euro invested results in a return on investment of 30 euros. This is why we talk about an investment in ear and hearing care rather than expenditure. The problem now is that many people do not have access to the hearing services that they need. This may be due to coverage that's not inadequate. For example, a part of the population could be left without access to hearing services, or it could be that some interventions are not covered by current health and social care policies. It can also be due to lack of professionals that people are not able to access hearing services. It could either be specialists or generalists that are not available. It could also be training of those professionals that currently doesn't reflect the best practices or doesn't reflect population needs. Those issues, and therefore these areas for action, they've been raised already by several of the presenters today. Here I take the example of the specialist hearing healthcare workforce. Coverage is unequal. As you can see, some countries clearly lack either ear and nose and throat specialist, audiologist, speech and language therapist, as well as teachers of the deaf. I see the solution as twofold. Firstly, it's about increasing the training capacity and the retention of the specialist healthcare workforce. And secondly, it's also about training the non-specialist healthcare workforce, whether they be general practitioners, nurses, or community health workers, so that they can identify ear and hearing conditions, so that they can offer primary care that is effective, and also they can refer more complex cases where needed. You've already heard today that 60% of the need for ear and hearing care services can be addressed at the primary level of care. Before we continue on solutions for quality hearing care and rehabilitation in Europe, I'd like to just pause for a little bit. And that's because I'd like to introduce you to someone, and this someone is Paulina Lewandowska. She's young. She's wise. She's a woman from Poland. She's full of energy. She's a PhD student, and she's an advocate for hard of hearing individuals like her. She's also the president of the International Federation of Hard of Hearing Young People. We're gathering today to talk about the future of ear and hearing care policies in Europe. And therefore, I find it very fitting to give the voice to Paulina as someone who has lived experience of hearing loss and as someone who represents the future of Europe. Recently, I asked Paulina whether there's a myth that she'd like to debunk, and I would like to share her reply with you. Paulina says, I wear glasses. When I put them on, suddenly I can see everything clearly. I can function normally. My vision no longer affects me. When a person receives cochlear implants or hearing aids, this is when rehabilitation begins. It's not a cure. Situations will arise when the person's functioning is still impacted, even with cochlear implants or hearing aids, for example, in noisy places. Sometimes people tell me, you have hearing aids. Why can't you hear me? Why do I have to repeat? People think that hearing devices cure hearing loss, and this is a myth that I want to debunk. So, with Paulina's input in mind, What is quality hearing care and rehabilitation? Clearly, it includes hearing devices, but it's also much more than that. The WHO World Report on Hearing, which was published in 2021, outlined a vision for integrated, people-centered ear and hearing care. It said that we need to integrate prioritized ear and hearing care interventions, and that needs to be delivered through a strengthened health system. And the acronym HEARING was being used to describe the different components of integrated people-centered ear and hearing care. The H stands for hearing screening and intervention, and that includes hearing screening and early intervention programs through the life course. So with newborns, infants, children that either yet to reach school or that are currently in school, those that are at risk of developing hearing loss, for example, those that are exposed to noise, those that are exposed to chemicals that might damage their hearing, which we call ototoxic, and older adults. The E stands for ear disease prevention and management, and that includes addressing common ear diseases. For example, middle ear infection, so otitis media, is very common in children. That's an example of a common ear disease that needs to be prevented and addressed quickly. So with early identification at the primary level of care and as necessary medical and surgical management. The A stands for access to technology. And by that, we mean access to affordable, good quality hearing devices such as hearing aids and implants, along with the batteries and the services that are required for people to use those devices independently. And also availability of other forms of hearing assistive technology. By R, we mean rehabilitation services. And this is partly what Paulina was hinting at, saying that technology is one thing, but people with hearing loss also need multidisciplinary, family-centered rehabilitation services for children, but also for adults, because counseling and rehabilitation will also be required for people of all ages. By I, we mean improved communication. That includes captioning, just like today, in professional as well as in recreational settings, sign language, interpretation, which are important in all settings and especially in educational and healthcare settings so that people have access to the information they need. By N, we mean noise reduction, and that can be, in the workplace for people who work in places where the noise level could be damaging to their hearing. It can be through standards for safe listening through devices. For example, when we're listening through our mobile phones, our tablets, or our computers. Regulation in venues, for example, in bars and places where noise levels could be high, and targeted programs so that teenagers know how to listen well and throughout their lifetime. By G, we mean greater community and engagement. So that means making sure that all the stakeholders are brought at the table, just like today, and making sure that organizations, associations that represent people that are deaf and hard of hearing have the resources that they need. So overall, hearing across the life course requires a multi-stakeholder action through collaborations just like today. With these considerations, WHO called upon its member states to scale up ear and hearing care for achieving the global targets of 20% relative increase in hearing care coverage by 2030, in alignment with the United Nations Agenda for Sustainable Development. There's 3 focus areas that have been identified. You're seeing them on the screen right now. It's about newborn hearing screening. It's about coverage of hearing devices in adults. And it's also about identification and management of ear disease and hearing loss in children that are of school age. You can read more about those targets and indicators in the WHO World Report on Hearing. So our overall goal is that people in need have equal access to quality ear and hearing care services. And overall, we can think of three main actions that we need to look at: prevention of ear and hearing conditions through effective public health strategies to prevent the occurrence of or the progression of hearing loss. Early identification, so that when hearing loss occurs, it's important to identify it as early as possible to have the best outcomes. And that can be systematic screening of people across the life course, as I've said already. And I just want you to remember that it's technically and practically possible to identify hearing loss at all stages of life, from birth to old age. And when hearing loss is identified, it can be effectively addressed through a holistic approach that includes provision of hearing technology as well as person-centered rehabilitation. And like most things, really, one size rarely fits all. So each country should determine their strengths and challenges by conducting an evidence-informed prioritization exercise where all the relevant stakeholders from the relevant sectors should be involved to address the challenges that are faced regarding ear and hearing care, and to move on the path to universal health coverage, where people have access to the care that they need without suffering financial hardship. The countries need to adopt this integrated, people-centered approach to ear and hearing care. I thank you for your attention, and I look forward to our live debate following very shortly. Also, I just want to remind you that WHO is committed to providing technical support to countries that are embarking on the journey of strengthening their health systems. Here is my email address. You see it on the screen. You're very welcome to contact me directly should you wish to explore technical support that's available at WHO towards integrating people-centered ear and hearing care within your national health systems. Thank you.